Hey everybody, I'm Dr. Kevin Usry, here from All American Wellness, and brought to you by Podcast Junkies. That's podcastjunkies.com, Junkeeze. So today we're going to talk about treatment of a low back condition. Could be from an automobile accident where we're dealing with disc injuries, or it could be someone just simply has developed low back pain. So we're going to show you how we do things at All American Wellness Center. And today I'm going to have my assistant, who's normally my boss in All American Wellness. She manages the clinic and tells all us gentlemen what to do. The doctor, the two PAs. We all listen to Heather Klein. And frankly, today I am going to slip into my familiar role. Heather's going to tell me what to do. So without further ado, Heather Klein.
Well, thank you for that introduction. That was nice. As we've discussed in previous podcasts, we were involved in an auto accident in April, and I'm experiencing quite a bit of lower back pain, as well as some neck pain, some referred pain into my arms, and some referred pain into my buttock. So we're going to go over how to treat those things with an adjustment gun, a laser, and also some percussive work. So let's get started.
Okay, so I guess what we'll do first is we'll have you assume the supine position. For those of you at home that didn't study anatomy, that's laying down on your back face up. When you go to any chiropractor, they are always going to look at your posture to see what your muscles are doing. So if the muscles are functioning normally, your posture should be symmetrical. If it is symmetrical, they can get a basic understanding that the muscles are in balance. They will do palpation, meaning they'll feel around the low back to see whether there are muscles that are tight and spasmed or whether there is swelling. And at that point, they're going to look at your spine to see if you have subluxation. Bones that are not moving properly in their normal joint space. They're not rotating normally, they're not bending to the side normally, bending forward and bending backward properly. We do that as all chiropractors do. When you do applied kinesiology, you're testing muscles for function, and we're going to do that today. So I just want it to be understood that we've already taken care of the basic things that all chiropractors do. We've looked at Heather's posture, which is asymmetrical, meaning one hip is higher than the other. We've looked at Heather's range of motion, which is reduced a little bit in rotation. Now I'm going to show you what it looks like to test a muscle for function and to test a myotome. What's the difference? A myotome is a specific nerve root that supplies a specific muscle. When it is not functioning normally and the person has a history of being involved in trauma, we assume they have a disc problem, and after that assumption is focused and looked at more deeply and more intricately, and we determine that yes, in fact, they do have a disc issue, we reduce the disc using our adjustment instrument, and then we retest the myotome for function. I'm going to do a little bit of both myotome function and muscle function, and I will let you know as we proceed. And I am going to use first the adjuster instrument, then I will probably use the percussor to deal with myofascial adhesions, and the next thing I will use is the laser, which is, in my opinion, one of the most important developments in the healthcare field in the last 50, maybe even 100 years. It's healing light that goes right into the cells of our body, any cell, a muscle cell, a nerve cell, a skin cell, a tendon cell, and works right on the cellular level to help the mitochondria. For those of you who don't know what mitochondria is, it's a special part found in every cell that produces energy. And in the body, energy is known as ATP, adenosine triphosphate. So without further ado, let's get started, and let me show you how we work at All American Wellness Center with a person who has low back pain and leg pain or numbness and tingling in the leg or weakness in the leg so that you have an idea what it's like to go to the chiropractor. All right, let's get started. All right, so first off, since we are doing applied kinesiology, we're going to look at some muscles for their normal function. So at least we have a basic understanding of how Heather's nervous system is functioning. She did say she was involved in an automobile trauma where her neck and her low back were injured. So we do want to see if the messages coming from the brain go through the brainstem into the neck, what we call the cervical spine, and those segments are supplying a specific muscle known as the pectoralis major clavicular. So give me some resistance, Heather. Now, if you notice, I'm looking for resistance from Heather. She's providing it. It's not a strength contest. It's a test. The next thing we're going to do is we're going to take Heather's thigh and we're going to push it into the pelvis and into the lumbar spine and see if compressing that area causes that muscle, which is functioning normally, to reduce in its normal function. So we'll check that right now. So I'm going to get in position. I'm going to grab a hold of the thigh and push headward and ask Heather to resist me. And she is. And we're going to do the next step by looking at the left side. And Heather, resist me. And there we have seen that as we approximate the lumbar spine, because there are some injuries to the disc, that has created a dysfunction in that muscle when we test it. So now we're going to test a myotome. Again, a specific muscle supplied by a specific level of nerve roots in the lumbar spine. So the first thing we're going to look at is L4. Whenever we're dealing with the lumbar spine, we use that first letter L. And this is the fourth bone in the lumbar spine. We have 5 bones in the lumbar spine, so this will be the fourth one. That particular area supplies the quadricep, that big 4-bellied muscle in the front of our thigh. So we're going to test that right now. So Heather, bend this leg for me. And don't allow me to push down. And as you can see, as I push on it, that muscle is functioning normally. This isn't how I normally function at the office, but we don't have a camera on us, so I'm going to stay on this side, even though it puts me in a slight physical disadvantage. Bend here, don't let me push down. Now, we're going to do something that we use in applied kinesiology called therapy localization. It almost looks magical. It's not. Our body functions magically, and it's great to be able to demonstrate this on camera. If you touch an area where there is dysfunction, that muscle that isn't functioning normally will instantly return temporarily to normal function. So we're going to try that. I want you to put your finger here. Now, this particular area that Heather's touching is equivalent with L2. Resist me. And that doesn't help at all, because the problem is actually in L4. So we're going to go right on top of where that disc is located anatomically, and we're going to have her touch that right there. Now bend and resist me. Try again. So that returns it, which reinforces to me that this is an issue with a disc that's swollen. And we're going to use a gun. This particular gun, as I call it, is an instrument adjuster. It provides a thrust of no more than 8 pounds, and it's reproduced constantly. It never gets tired, it never gets moody, it never gets distracted. This is why I like to use this instrument. So I'll have you bend your leg. Now we're going to go anatomically right on top of that disc. I'm going to tell the patient they're going to feel a slight cramp, because when we're touching that nerve, it can create a cramp. For women, no big deal. They deal with these types of cramps every month. For men, I kind of embarrass them a little bit and say, this is what your wife or your girlfriend goes through every month. Let's see if you're tolerant for it. Now you're going to feel a slight cramp. And as we listen to the instrument, it's dull. It's meeting resistance. We'll continue doing that until it starts to echo, which it's doing now. That means it's no longer getting resistance. That's how simple it is to manually adjust a disc swelling using an instrument. Now we'll follow this up with laser and with decompression, which is a fancy name for long axis traction. It's very comfortable. It is very effective for reducing disc injuries, and it is the treatment that you utilize and hopefully is successful, because if it's not, patients need to get injections, patients need to have surgery. So we're always hoping that they respond well to conservative care, which is what chiropractic is all about. Let's have you bend this leg. Okay, don't let me push down. Okay, now what I do with patients is I have them do something called the Valsalva maneuver. They bear down like they're having a bowel movement, and this creates a lot of stress on the disc, so we want to make sure that even from what we call a subclinical level, when we stress it, if it has in fact remained functional. So here we go. Bear down. And that's it. As simple as that. And this is an example that we don't always like to tell others about, but unfortunately, Heather is going to have injective therapy. She's been a very good candidate. She's been a very good patient. She's attended her chiropractic adjustments. She's been getting those. She's been getting the decompression. She's been getting the laser therapy. She's been careful about her activities of daily living. And in spite of that, she has had a very serious injury and has to go see the orthopedist that we use for injective therapy, in hopes that that will solve the inflammatory issue that continues despite us doing this conservative care. Now that we've addressed the disc issue, let's just look at what it looks like when we test a muscle. And we'll do that right now. You can relax this one and lift this one. And we're going to turn this leg out, and we're going to see, as I put pressure on the leg, if it functions normally, which it does. That muscle I checked was the psoas muscle. When we look at me from the side without a coat, you'll see a curve in my back. That's the function of the psoas muscle. It pulls on the lumbar spine, it supports the lower back, it's a hip flexor, and for all of you who find you have a lot of pain when you get out of the car, when you get up from the toilet, and you have a difficult time straightening up, that's your psoas muscle. So we always look to see, is that functioning normally? Let's check the other side and turn out and hold up. And yes, the next thing we'll do is we'll test the rectus femoris. Now that that disc has been reduced, we're looking at the muscle function purely. Lift this leg up, hold it up. Try again. Okay, Heather has muscular thighs. I shouldn't be able to move that unless there's a dysfunction, and there is. Let's go ahead and try the left side and hold. And I can pretty much lean on that, and that's not going anywhere. So what you have is function, dysfunction. So we fix that quite simply. Again, using the adjuster, it's comfortable. One of the things we see clinically when a person has this phenomenon, they don't have a normal function in their rectus femoris. Many times they'll tell me coincidentally, oh, my knee's been bothering me, my ankle's been bothering me, and I'm feeling groin pain here. And all of these clinical presentations occur when a person's tailbone or sacrum is subluxated. So we're going to fix that compensation problem first. Again, waiting for that echo where we're not getting resistance any longer. And this is all the compensation that occurs to the body when another part of the body is not functioning normally or is subluxated. Lift this leg up and hold it up. Function, function, yay! Okay, let's have you take your glasses off and lay on your tummy. So we've shown you what happens in the office when we're looking for disc problems or any other muscles that may not be functioning normally, the next thing we look at is the butt muscle. Why? It's the strongest muscle in the body. If it is not supporting you, your entire torso, that means your low back, your mid back, your neck, all of those areas of the body just really are put under a lot of stress when the strongest muscle in the body isn't functioning normally. All right, so we're going to have you bend this leg and lift it up and hold it up. Now that is good function. Let's have you do it with this leg and hold up. Again, normal function. So now we're going to look at the muscles that line the spine and support the spine. They're called the sacrospinalis muscles. For those of you who are not too interested in Latin, I'm going to break it down anyway. Sacro, meaning sacrum, our tailbone. Spinalis, the spine. So the muscles that attach to the area of the sacrum and all through the spine and support our spine. They bring us up like so. So lift this leg straight up and hold it up. And that is not a normally functioning sacrospinalis. So we have some issues. Let's try the other side and hold. Clinically, from doing this about 40 years, I know that one of the first things that pops in my head as what could be wrong is a subluxation between the mid-back and the low back. So T12 is the last bone in the mid-back, and L1 is the first bone in the lumbar spine. So those transitional joints are having an issue of support. And we're going to change our instrument pieces to get both sides of the spine. I'm going to palpate this area, which means I'm feeling to see if proper movement is there. It's not, so we're going to simply do this right here. Again, if you can hear it, it's dull. And we're waiting by repeated thrusts of less than 8 pounds, reproduced constantly, to get that bone and those bone areas to move normally till we eventually get that vertebrae and subluxation reduced. Now, if we've done our job, we should be able to go back to see what brought us there to see if it's functioning normally. Lift up. Good. So we've got normal function here. And bend and hold. Straight leg. Good. Is that hurting you, Heather?
No.
No? Okay. So when a sacrum is subluxated, one of the other things that happens to patients is those muscles that bring their head back and help them turn don't function normally. And this is why often people are kind of perplexed when I fix their sacrum and they say, yeah, but doc, my pain's in my neck. Yes, but if you remember when we tested it, that part of your neck wasn't working now. Let's try it again. So this is what we simply do. Lift your head up for me, please, and turn it, and don't let me push down. Okay, and turn your head, and don't let me push down. And those muscles just simply don't work right because this is the way God made our body. When areas of the spine as low as you can possibly go are not working normally, as high as you possibly can go in the spine, those areas don't function normally either. So we're going to simply reduce that area. I'm going to palpate again, feeling for subluxation, which is right here. We're going to place the instrument here on the sacrum. Again, it's tall. I'm just waiting for that repeated thrust to free that area up. Be patient. There it is. Okay, so we didn't get that lovely echo like I like to hear, but we're going to test to see if the muscles that were dysfunctional are now working normally, which indicates to me the sacrum is back to where it belongs. Lift your head for me, turn it, and resist me. Good. Turn it and resist me. Okay, so that pretty much covers what we do at All American Wellness. When we see problems in the low back, could be a disc problem, could be simply the muscle isn't functioning normally, and it will always be the vertebrae are not moving normally. Those special bones in the spine, the vertebrae, are either not rotating like they should, bending sideways like they should, bending forward or bending backwards, and as a result, the muscles may not be working the way they should, or discs that sit between those bones are swollen and they don't allow those bones to move normally. So I want to thank you very much for joining us. Remember, you can catch us on Spotify, on Apple, and on YouTube. We're there once a week talking about all about health and wellness. And we will join you next week. And I think we're going to talk about things that may affect the knee as far as normal function, so we get knee pain, or the ankle and foot as far as pain. And we're going to talk about gut function. So stay tuned next week, and we'll look forward to joining you. Again, we're here because we're sponsored by All American Wellness. Call us at 561-863-8779. That's 863 USRY. I'm Dr. USRY, so just give us a call. We have a free 15-minute evaluation to see how you're functioning. Could be a mechanical issue, could be a biochemical or nutritional issue, could be a bioenergetic issue that needs acupuncture. We do it all at All American Wellness. It's been a pleasure talking with you and sharing what we do at All American Wellness, and I wish you well until I see you next week.